Okay. Hi, and welcome to another Apps in Didactic brought to you as part of the Multi-Site Didactic Initiative. We're pleased to have Kelly McNally present today on the topic of pediatric board certification through ABPP. Dr. McNally is a board certified clinical neuropsychologist with subspecialty certification in pediatric neuropsychology. She's the director of neuropsychology fellowship program at Nationwide Children's Hospital in Columbus, Ohio. And she's an associate professor of pediatrics at the Ohio State University. She's one of the co-chairs of the Pediatric Subspecialty Board Promotion and Mentorship Committee through ABCM. And we'll be talking today about the Pediatric Subspecialty certification process. So thank you, Dr. McNally.
Thanks. So as Amy mentioned, sort of my goal of this presentation today is really just to demystify the process of what goes into pediatric subspecialty certification. What is that process like? What should fellows be thinking about during their fellowship years as ways to best prepare them to be well suited to kind of seek that out moving forward. Before I jump too far in, I wanted to also acknowledge my co-chairs for the Pediatric Subspecialty Board Promotion Committee, Dallin Pulsifer and Rachel Tangent. So they also worked with me on creating this presentation. And they're also, a good resource of people to reach out to if you have questions about pediatric subspecialty certification. And then just a quick note on sort of the goals of our committee. So we were really formed just to help get the word out about the pediatric subspecialty, since in some ways it is relatively new still, and also to provide a reference or resource for folks if they're going through this process and have questions or looking for mentorship about things like their practice samples, which we'll talk a little bit more about as we keep going. And I'm happy to stay on, as Amy mentioned, to answer any questions that people may have about this process when we're done. So first, I wanted to start by going through an overview of the overall ABPP board certification process for the clinical neuropsychology program, or for the clinical neuropsychology certification. So I think, that's sort of one first off misconception or myth that people may have just about board certification and clinical neuropsychology in general, is sometimes people call sort of the parent board the adult board, and then the pediatric subspecialty is the pediatric board. And that really isn't necessarily the case. So to get ABPP certified in clinical neuropsychology, that process really touches on concepts that are relevant for both pediatric and adult practice. And there are several pieces of that process that you can really focus in on pediatrics. The pediatric subspecialty comes after this process. So once you are board certified in clinical neuropsychology through ABPP, then a next step after that, if you want to get the pediatric subspecialty certification, would be going down that route. So most of today we'll be talking about the process of that second piece of sort of once you've passed through the parent board, which we call it, or the overall board process for clinical neuropsychology. Those next steps would be for pediatric certification. So just to review the steps, is I think most fellows usually get a pretty good understanding of what goes into going through the ABPP process for the parent board or in clinical neuropsychology, but they may not be as familiar with those next steps. But just a quick review. So the steps for the parent board are really first a credential review, then the written exam, and that written exam is going to include concepts that are relevant to both pediatric and adult practice. Then you submit your practice sample, and in that case, you have two cases that you would submit. You're free to choose pediatric cases, or you can choose adult cases. Obviously, if your training and practice has been in pediatrics, it makes sense to submit pediatrics cases for that section. And then in your oral exam, which is the final step, there's three main sections of that. The ethics and professional practice section, and then your defense of your practice sample. And that's going to be based on the cases that you chose to submit. So if you chose pediatric cases, you're going to be talking about pediatric issues in your practice sample defense. And then the third element is the fact-finding piece. And you have the option to choose a pediatric or adult focused case. So even that first step in the process for overall board certification in clinical neuropsychology can and is, very much tailored to pediatrics if that is your area of specialty, and if that is sort of how you want to choose moving forward with your samples and pieces of your oral exam. I also wanted to give just a brief sort of overview of the timeline of the pediatric subspecialty, because as I mentioned, it is a relatively newer credential that's been offered. I also wanted to just kind of I think sometimes there's a little bit of confusion about what is the difference between the subspecialty certification through ABEP versus what is ABPDN. And so just a little bit on that, and that kind of comes through with the history of the subspecialty. So ABPDN is a separate board, not affiliated with ABEP, but they, back in 2006, applied to become a separate board, separate from the clinical neuropsychology board through ABEP. Really, and that came about just recognizing that there are some unique aspects to practicing in a pediatric setting, and there are some unique competencies that should be considered if you want to declare yourself as an expert in pediatrics. In 2007, ultimately, that decision to have a separate board from the clinical neuropsychology board was denied. And, it was really carefully considered, but I think there was two main reasons why it was not granted to be a separate board from clinical neuropsychology. And really that was just that it was not deemed to be really distinct from the overall clinical neuropsychology process through ABIP. And really that the ABCN process already assesses competency in pediatric neuropsychology. So as I mentioned, in that parent board process, the written exam is asking about both adult and pediatric related concepts. And, you can certainly use pediatric samples, and your oral exam is going to, touch on a lot of those concepts that are very relevant for pediatric neuropsychology. So it was decided that a full separate board was not needed through ABEP. But that said, that did really bring up the discussion that there are some, particular areas of expertise and particular competencies that folks who really specialize in pediatrics, want to demonstrate. And so in 2007, a committee to study the subspecialty was formed. So Mike Westerfeld was the head of ABPP at that point, and sort of started the committee to look into the pediatric subspecialty certification. And that was chaired by Dr. Ida Sue Barron. In 2008, that was first proposed to ABPP. And then in 2009 was when they had the first SIG meeting in pediatric neuropsychology at AACN. So the initial goal of that SIG was really to help with this developing the pediatric subspecialty process. Since then, since it's been developed, now the Ped SIG is really more focused on practice issues in the area of pediatric neuropsychology. And then in 2014, that was when the first pediatric subspecialty credential was awarded. Now at this point, we I think are up to 133 board certified subspecialists in pediatrics. So one of the biggest questions that we get in our board, promotion committee is really, why should we do this, right? So, I think there's a lot of, drive to go and get your overall certification in clinical neuropsychology. But why should we do this next step? It is a lot of steps, right, to get through even the main board. What's the motivation? What's the drive to kind of continue? And so we actually surveyed our current board or subspecialists last year to really, hear from folks of why did they decide to do it. So I put up a couple quotes from people that, sort of highlighted some themes that came out. So for example, this person said, I believe that this should be and will be the standard of care in the future. I think that the process of boarding makes you a better neuropsychologist itself. And I think that was a theme that came up very frequently, is that thinking about your work and going through these steps really does help your clinical practice moving forward. Other themes were, really it enhances your own knowledge base, and then really just to show that you have that highest credential in pediatric neuropsychology. Other things came up, folks who do more forensic work, that this could come up in things like depositions, and it shows to your referral source. And my parents, I think they said maybe they met patients, but your parents would also be very proud if you got the subspecialty certification as well, but really showing off that you have that, particular level of training and expertise in the area that you practice. So really kind of summarizing it down of why should you be thinking about this? Why should you think that this is going to be, sort of that final step in your certifications? And I think, the first main theme is it really just demonstrates your competency in that area that you are going to have expertise in or that you do, right? And that's showing that area of competency to your colleagues, to your trainees, to your patients, and to yourself. A lot of themes also came out and just that it's good for the field of pediatric neuropsychology as well, right? If we have this group of board certified professionals, that really increases our cohesiveness and our ability to advocate for things within our profession and for our patients. There are also a lot of practical advantages as well to you as an individual. So first being that, being a subspecialist, you really join, a community of clinicians who are also, experts in pediatrics. There is a special or pediatric subspecialty listserv that only those folks that are boarded in the subspecialty have access to. There are just colleagues that you have within the subspecialty where you can talk about case conceptualization, discuss issues specific to the field, coordinate advocacy efforts, those sorts of things. So there is just a benefit for being part of that community of subspecialists. Again, one of the things that just came up so many times when we were surveying the people that are subspecialists is how much just going through this process really does enhance your skills and knowledge. So, as you all know as fellows, you're learning every day in fellowship, but we're also learning every day in practice. And, going through a process like this really helps you sort of examine your own work and think about critically about why you make the decisions that you do and why you're practicing the way that you are. Finally, there are also some financial advantages for going through the process potentially. So there's a lot of institutions that may offer pay raises once you get the certification. Especially if you're in private practice or in a forensic practice, it may help with referral sources, or it may be something that could increase your credibility for forensic type cases as well. So I think overall, there's a lot of reasons for you personally, and also just for the profession in general. So what are the steps to becoming a subspecialist in pediatric neuropsychology? So first, again, the first step is going through ABPP and getting your certification in clinical neuropsychology in general. Once that's done, then the sort of final step in your process is going through these steps to become the subspecialist. So the first is a credential review. Second, there's a written examination. And third, there's a practice sample. So if you remember, there's a fourth one for the main board or the parent board, but we don't have the oral exam for this part. So it's really just these 3 steps. And I'll talk a little bit in more detail about what each of those entails. So in terms of timeline and fees, so just some details about this. You can start the application process before you're done with the clinical neuropsychology boarding process, but you do have to be board certified before you go on to the next step of taking the pediatric subspecialty written exam. You have a 3-year window from the time that you sort of pass that eligibility stage to actually completing everything. If you don't get it done in that 3 years, you can start over, but you would just have to reapply through that initial credential review process. Just to get a sense of the timeline. So for myself, I finished the parent board and I took the oral exam in March. Then I submitted my application right away after that. So then I sat for the written exam in June at AACN that year, and then submitted one of my cases that I had used for the parent board, which I'll talk a little bit more about those details as well. And so then, kind of went through the pediatric subspecialty process pretty quickly after my going through the main board. So kind of just continued that momentum. Fee-wise, so starting the first credential review process, there's no fee for that piece. There is some fees for the written exam and also for the practice sample submission. I just wanted to point out for the ABIP process in general, APSIN is now offering some scholarships. So that was a new thing that just came out over the past several weeks. So that is an option too to help fund some of these aspects that you might be paying for as part of going through the board process. So for the credential review, really what that entails is submitting an application that is going to highlight your work and training in pediatric neuropsychology. So you're really going to highlight those experiences that sort of show your evidence of having expertise in clinical work, research, and or supervision and training, depending on what you do in your career. And just, to point out to you for the purposes of our discussion, when we're talking about pediatric cases, and will be the case for the practice samples as well, we're talking about cases from 0 to 16. So sometimes though, people who focus more on that AYA or young adult population, that wouldn't necessarily fall fully under the pediatric realm. Part of your application also involves attesting that you are doing practice in the realm of pediatric neuropsychology. So in order to get to the point of applying, you have to be in practice in a pediatric setting for 2 years, which again, that lines up pretty nicely since you have to go through the main board first. You would definitely have that unless you are switching over to pediatrics later. You do have to, though, have 4,000 hours in a pediatric setting, and then 1,000 of those hours have to be supervised. And so, for people doing a fellowship in neuropsychology, getting, a half-time pediatric experience, that would equate to about that 1,000 hours. You have to also have 2 letters of reference, and those are just people attesting that you are doing pediatric work, and someone attesting that you did get those 1,000 hours of supervised work in pediatrics. Preferred letter writers, they don't have to be, but if you have someone who's ABPP certified or someone with a similar level of knowledge, education, and training in the practice of pediatric neuropsychology. So once you pass the credential review, right, so showing that you do work in a pediatric setting and you have experience in that area, the next step is to sit for the written exam. So this written exam, I will say, is very different in a lot of ways from the parent board exam, in that it's shorter and it really has, I think, less preparation that maybe needs to take place for it compared to maybe the overall parent exam. And that's because it's really going to be asking questions that you would know, and you do know every day if you have been practicing as a pediatric neuropsychologist. So for that reason, there has been really high pass rates for the written exam. So don't think about the written exam and for the subspecialty as a really big rate limiting step or a really huge time consuming aspect of this process, because if you're getting through that credential review, meaning you're showing that you have the training, you have the work experience in pediatric neuropsychology, the questions that you're going to be asked are really things that you work with day to day. And so, that makes it in some ways an easier preparation process than maybe for the main board exam, where you might be asked about some concepts that maybe you don't work with day to day in all settings. There's only 30 questions of it as well, so that's pretty nice. It has historically been given at AACN conference, but since COVID, that has been online the past 2 years. I'm not sure what the status of that's going to be moving forward, but historically it's been, offered at AACN. Here's a listing of the topics that are covered. So again, a lot of times if you're working in pediatrics, these are going to be the topics that you really are, using day to day in your practice and thinking about and keeping up on this literature anyway. So it's going to, obviously have questions that are a little bit more focused on what you need to know in pediatrics. So pediatric clinical syndromes, questions about neurodevelopment, psychopathology in childhood, role of family, issues related to cultural diversity in the field, any ethical or legal issues that are specific to pediatrics, intervention strategies within pediatrics. But as I said, I think they're truly focusing on topics that you do, have knowledge of if you're working in this field. So once you all pass the written exam, the next step that you'll go on to is submitting your practice sample. So one thing to keep in mind is that for the parent board exam, The overall goal of that practice sample is to demonstrate your knowledge that can be defended in an oral exam. So for the parent board, if there's questions that someone might have, you have that oral exam to sort of say, this is why I did what I did, or I did consider that, and this is why I ruled that out. For the pediatric subspecialty, we don't have that oral exam, which for a lot of people, that is a positive. They're like, thank goodness, I don't have to do that again. It saves me time, money, stress of going through an oral, all of that. But there is some certain things to consider with that is that, your sample, meaning the case that you submit and the supplemental section, which we'll talk about, that sample in itself has to show your competency in pediatric neuropsychology. So you don't have that chance to answer questions about it. So you have to use your supplement and make sure that those concepts are really illustrated in the case that you choose. But there's no oral exam, which I think a lot of people view that as a plus. So the overall goal of that practice sample submission is really to demonstrate your competency as a pediatric neuropsychologist. So really, it is as simple as just using an example of your typical clinical work to show that you can do the things that you all are doing, right? And that's, obtaining relevant background information, identifying the referral question, choosing a test battery that's going to answer that question, interpreting your data in context of the history that you've gathered, applying your knowledge of brain behavior relationships, based on that, making appropriate clinical recommendations, and then presenting that information in a report, right? So that is every day what we're doing as neuropsychologists, and really that's all this practice sample is meant to do, is really just show your skills in that area, but specific to pediatrics. So a little bit on the details of that piece. So you just have to submit one case. So remember, I said the parent board, you'll do 2 cases, but for this, it's just going to be one case that's representative of your typical clinical practice. Again, this is focused on pediatrics, so the patient should be 16 or younger. So some of those young adult cases maybe wouldn't have as many of the developmental aspects to highlight that. So that's why we do want you to have a younger case in there, or at least 16 and below. The case has to be relatively recent, so someone that you've seen within the past 2 years. Obviously, it has to be de-identified. So you're going to redact your information and all of the patient's information. You're going to submit the raw data, so scanning in the protocol forms, as well as a score summary sheet, and then also reference which norms you used. Again, obviously, as we know in pediatrics, sometimes that is certainly a thing to highlight which ones you're using. You scan in the protocol forms and kind of pull all that together. And then there is a mandatory 3-page supplemental statement, and I'll talk a little bit more in detail about that piece. And then, as I said, no oral exam, and so that supplement is required, whereas it is optional for the parent board. For the subspecialty, it's required because we need the sample to speak for itself without that oral defense. So the review process, so there's 2 reviewers who are going to evaluate your submission. And so these are reviewers who are subspecialists who have been trained in sort of standard ways to review this. And they're going to be reviewing these in a uniform fashion. And as I said, the supplement or the sample is de-identified for both yourself and the patient. If both reviewers agree it's acceptable, then you're done. Then you are a pediatric subspecialist. If there's a split decision between the 2 reviewers, it will go to a 3rd reviewer. If ultimately based on that, it is determined it's not acceptable at that point, then you will receive written feedback. And the goal of that is to help you know what were the strengths and weaknesses and of the sample, and what are some recommendations for moving forward. And you are able to resubmit not that case, but a different case to kind of continue if you're not successful at the first try. And as I said, you have 3 years from that initial credentialing time to get through that. And if for some reason you don't within that 3 years, you can also go back and reapply from the application stage. So the criteria for an acceptable practice sample. So, the things that they're going to be looking at when they're, determining whether or not a sample is accepted. is it should be, illustrating your knowledge of using developmentally appropriate measures and assessment methods. It should include recommendations that are gonna, convey your awareness of brain behavior relationships and really taking that developmental aspects into consideration. Your recommendations, again, should be evidence-based for children and family, and they should be, integrating the information that you know about neuropsychological dysfunction, development, and sort of what the role for following up sort of throughout the course of development. So again, I think I sort of highlighted the key pieces as that your sample really, needs to illustrate your knowledge of developmentally appropriate neuropsychological evaluations and showing that brain behavior piece and showing that you're basing your recommendations in evidence. The practice sample also needs to include, a conceptualization that sort of takes all those factors into account. So again, the sample itself has to demonstrate your knowledge of brain development. It needs to be integrative. So, understanding things related to, psychopathology, the family, genetic factors. It should also highlight an appreciation of, say, the time of the injury or insult or onset of the condition, and then what the trajectory is given the age of that insult. So again, it's assessing whether or not you can understand how things might be different for having an injury or an insult or a condition that starts during early childhood, how that may impact development moving forward. That is a different competency in understanding as opposed to, adult level neuropsychologist. Want to make sure that you are certainly showing your competency with cultural considerations. So this is a big piece to make sure that you are considering factors related to language, racial and ethnic background, socioeconomic status, disability, other types of diversity considerations to include. And again, if some of these things that you've considered are not specifically spelled out in your report, then those would be an area that you would want to talk about within your supplemental materials. So the timeline for this sample is something too I wanted to highlight, because I do think for some people they can get hung up on this step and, really obsess over finding like what is the perfect case and spend a lot of time just sort of, trying to find that perfect case. And I think, the answer is this really should be a reflection of your typical clinical work, and there is no perfect case. And I think especially in pediatrics, right, we don't always have these cases that are super neat and clean, and it's a left temporal epilepsy case and they have just verbal memory deficits. That usually doesn't happen, and that's because of the complexities of development as well. And so I think don't focus so much on just having this case that you think just perfectly, illustrates a concept, because that can really hold you up. I will say what I did and what I certainly recommend is thinking through your timeline to consider submitting a case that you use for your parent board exam. So, going through that process of scanning, prepping it, de-identifying it, it can be tedious. And so if you can use a case that you've already done that for, that's awesome. So remember, your case has to be done within 2 years. And so that is motivation to just continue on this train and, keep working to submit this right away. The other advantage of potentially using a case that you use for the parent board exam is it can help you think about what should I write in the supplement, because I've been examined on this case, right? People have asked me, or a person's asked me questions about, asking me to defend my work. So I can, potentially think about those of points that I might want to make in my supplemental materials. And I think another push to kind of just continue doing it as soon as you can after the parent board is really the whole momentum piece. So I think, it is easy to lose that momentum. And so I think while you're in that mode, it's really great to just continue and just get this credential right away. I will say, give time to have your colleagues and mentors help you with this process too. This is not something that, the case has to be your own work, but certainly, you're encouraged to get mentorship and, advice on what to include in your supplement. Is this an appropriate case? Does this case really highlight all of the things that we're going to be looking for a pediatric sample? And as I said, just remember the preparation can take a little bit of time. So just, obviously it is supposed to be the original report. You're not changing the report in any way, but you can review it and fix typos, that sort of thing, and make sure it's redacted, but it does need to be the original work that you submitted clinically. And then timeline, it usually takes about 6 to 8 weeks to receive, your reviews. It is a process to review these. And, I think the reviewers are really spending a lot of time being really thoughtful about it. So it does take a little bit of time, but not months and months. So one of the biggest questions that we get on our board mentorship committee is, what case should I choose? So some things just to think about. So as I said, the case has to be your own work, unsupervised. So if you are supervising trainees at that point, it can't be, say, one of your fellows' cases. It's okay if you had a technician do the testing or a student do the testing, but you have to be able to attest that you wrote the report and this is your clinical work as opposed to being one of your trainees' works. You, like I said, consider using a case that you submitted from the parent board. I think that makes things a lot easier, but it is a good thing to keep in mind that just because it passed for the parent board isn't just a guarantee that it's going to pass for the pediatric subspecialty, because there are different criteria that they're evaluating on. And again, remember that that sample in itself needs to demonstrate competency in pediatric neuropsychology. And so, without having that defense piece, but it is, if you did have a successful case from the parent board, it is certainly a case that you would be encouraged to think about as using for this step as well. And really, the primary thing is this case should be a good case that shows your pediatric neuropsych skills. It should be a case that highlights, things to consider with neurodevelopment, and really, a case that can highlight your ability to understand brain behavior relationships. You're probably going to want to avoid, or you're definitely going to want to avoid, say, a research case. So maybe one where you're just doing a research battery, likely because you're not showing that you can choose a test battery to answer a clinical question, right? If you're just, doing a research battery and you may not have enough data and history and conceptualization in that case. You're also going to want to avoid a case that has either just a normal profile or a case with more severe global impairments. You could, it's just harder to demonstrate your knowledge of brain behavior relationships in those cases, because it's usually the variability in that profile that you're sort of explaining what that means. And so if there is no variability, it's just harder to demonstrate your knowledge of those concepts. If you do forensic work, a forensic case, it could be considered. It just might be a little bit more challenging to make sure that you're hitting all those criteria. So I won't say that's a completely no, but think through the criteria to make sure that that case is appropriate. And then I'll say the case also has to include recommendations that are tailored to the case. So, depending on the setting, some people's reports might not include a lot of recommendations. And so, making sure that you are using a case that does include recommendations that are tailored to relevant stakeholders, and that may be parents, medical teams, schools, et cetera. So the supplemental section, so again, this is one of the biggest questions that we get is what do I write in this section? So details, it's 3 pages, double space, 12-point font. I say use your 3 pages, and really try to maximize, what you're using, or what you're putting in there. References are not expected, so you're not doing an academic review of the literature. So if you're submitting a case on, say, pediatric epilepsy, you're not writing a review of the state of the literature of pediatric epilepsy. That said, you don't need to put references, but make sure what you're saying is founded in the literature, is founded in research, but you're not expected to have to reference everything that you're talking about in there. And as I said, just think about this supplement as the defense of your work and sort of taking place of that oral exam. So what are some things that you should consider including? You may want to include a brief description of your practice setting, especially if that puts these reports into context of what, or it's one report, but if it puts the case into context as to what types of cases that you're seeing, maybe why you wrote the report in a certain way, who the relevant stakeholders are, those things may vary depending on what setting you're practicing in. The supplement's a good place to include if there's relevant patient history information that wasn't included in the report. A lot of people, myself included, are really moving towards more abbreviated report styles, and there may be some history that you did get and consider, but you maybe just didn't write every piece of that in that written report. Totally okay, but if there is a piece of history that you really did use in your conceptualization, you'll want to put that in that supplement. Rationale, why did you choose the battery that you did? Why did you use the norms that you did? Are the norms that you use culturally appropriate for the case? What were the limitations of that you had to consider in your conceptualization? Any other cultural considerations in terms of your overall conceptualization, in terms of what recommendations you were giving, and just other things that you thought of that were, in terms of working with this family. Certainly, if the case brings up any ethical considerations, you 100% need to address that. Really just discussing what was your decision-making process. So what differentials did you consider? Why did you, what did you think through? Did you think, did you wonder about ADHD, but you decided not to make that diagnosis, and this is why, those sorts of things. And again, the way that I did it when I did my supplement is I just went through, like, what do I think people would ask me about? Like, why did you choose this test? Why did you, not diagnose them with this? Or, why did you think about, sort of the next steps for this case, who's a teenager that's going to be transitioning to adulthood soon? So those were the types of things that I included in my supplemental material. Again, I thought about questions that came up during the oral exam, and then I had a lot of folks look at it. So colleagues and mentors, if they reviewed it, like, what questions come to their mind? What would you want to know about this case? And then thinking to yourself, like, what was hard about it? What were some things that you thought about when you were conceptualizing it, but you didn't necessarily sort of spell out in the report that went to the family or to the physician? A little bit on just some common pitfalls. So, things that maybe have tripped people up in this process, and, just thoughts on how to avoid that. So one pitfall would be really just if the data that's included in your sample isn't sufficient to show your knowledge in pediatric neuropsychology. So, if you don't talk about brain behavior relationships, for example, in your report, you might know that, or you might have really thought about that, but if you didn't write that in your report and you don't write that in your sample, the reviewers don't know that you understand that, right? So if your report isn't highlighting an important concept, that's really going to be where you want to address that in your supplemental section. A pitfall could be not redacting information. So obviously, it's not going to be a automatic fail if in one line of one of your protocols there is something that didn't get fully blacked out, but obviously double check it, have someone else double check it for you, make sure everything's redacted, just so that people know that you're aware of those ethical issues related to protecting privacy. A pitfall could be if a relevant domain was not assessed. So for example, maybe you didn't do academic testing because they had a school evaluation that was coming up, or they just had a school evaluation, so you didn't reassess academics. Totally okay, right? Or maybe the practice setting that you're in, you don't usually look at academic skills and you're focusing more on cognitive skills. There may be a reason for that, and it may be completely defensible, but that you're going to want to put in a rationale why you didn't touch on one of those primary domains if you did not assess that. Another pitfall just would be flaws in the overall conceptualization of the case. So really, if you're not considering all of the factors that might be contributing to your findings, so if you're not integrating information about family history, maybe the patient had comorbid depression and you didn't consider whether or not that was, contributing to their overall profile. Again, if the patient was an English language learner and you didn't discuss that in your conceptualization, that could also be, again, a pitfall to consider, talking a lot about in your supplement. I think this comes up a lot, especially in pediatrics, when we don't always have these really neat profiles, right? So if you have a left temporal epilepsy case, and they don't just have verbal memory deficits, or they have a different type of a profile, ignoring that data that doesn't fit with that profile that you expect and not discussing it. And that is also a potential pitfall. And it's okay if it doesn't fit that, but just making sure that you're discussing what fits and what doesn't and why, and the role of development in getting the profile that you've gotten. Another thing could be attributing everything to the medical condition when maybe that's not consistent with the literature. So an example for that comes to mind might be a concussion case, right? So if they had comorbid depression or the role of pain or sleep disruption, and that may be contributing to, slower speed or issues with attention, but you're attributing it to the medical condition when maybe that's not consistent with what we know about concussions and how they may impact functioning. So again, just making errors overall in your conceptualization that really aren't consistent with what we know about the literature, particularly in pediatrics. Another pitfall could be if you're not doing effort testing or symptom validity testing or performance validity testing. So again, in pediatrics, this could be a little bit sticky, right? If you're working with a 5-year-old with more significant global impairments, you might not have done the MSVT, right? Or the TOM or something like that. And that might be okay, but you have to talk about why and what did you consider to look at validity in that case. So again, it may not be needed in all cases, but certainly when it's relevant to the situation. So if it was a forensic case, of course, or if it's a teenager with mild TBI, of course, you're going to need to do performance validity testing, but at least address that if it wasn't part of your test battery. It is really becoming more of a standard in practice. Recommendations need to make sure that they're showing your knowledge of appropriate things in terms of special education law, particularly when you're giving recommendations for schools. So I know this is a thing that may come up, that the way the recommendations are written, they're not showing that you have a knowledge of what are the factors from a special education law perspective that schools need to consider. And so making sure that your recommendations are in line with that. So for example, if someone had really minimal deficits or just a weakness in attention, and you're writing in your report that they 100% need an IEP even though they're having all A's in school, that's probably not going to be consistent with what they might qualify for according to special education law. So making sure that you're considering those things and what you're recommending to make sure it's viable and appropriate for the school setting. Another pitfall could be not really adequately looking at emotional or behavioral function, or not integrating those into your results or into your overall conceptualization of the case. So again, assessment of emotional and behavioral function is really a key part of our evaluations. And so you're really going to want to make sure that you're highlighting that throughout your practice sample. Not elaborating on pertinent aspects of the case. So again, there could be rule outs, explanations that you considered, and you didn't necessarily write them in your case, but just make sure then you use that supplement to talk about those things. Similarly, if there's pieces of the history that, if you read your report, you wouldn't know if they asked about that. So say you didn't have a line about early development, but you did ask about that and it was non-contributory, so you just didn't happen to write that. Or, that would be something that you would want to comment in your supplement to make sure that they know that you did consider that. And, you thought about that in your conceptualization, even if it wasn't specifically spelled out. This one comes up sometimes that you did not answer the referral question in any area. So, sometimes the patient may be referred, was there a change in function after the TBI? Or, are they showing a decline in function with their uncontrolled seizures? If you never actually directly answer that, that may also be a pitfall that comes up if you're not really answering that in your report. Not talking about neuroanatomy and brain behavior relationships. So again, some people don't always write this in their reports. Again, depending on who the relevant stakeholders are, that may or may not be a piece that you're including, say, to a report that's primarily going to a school. But that is part of our role as a neuropsychologist. And so you're going to want to make sure that you're really talking about that in your supplement. And I think that gets to this point here. As a pitfall of a case is really that it may not be truly a pediatric neuropsychological evaluation. So when you're looking at a case, think about, could this be confused with just an educational evaluation, right? Am I really using my knowledge of brain behavior relationships and neurodevelopment to inform my opinions here? Or is this an evaluation, that could have been done, say, in the schools? So are you, and are you specifically addressing developmental issues? So, if an adult neuropsychologist who doesn't have training in development, if they could have written this, then maybe this isn't really the best case to show your knowledge in terms of brain development. Your interpretation, if it lacks integration, that is also a very common pitfall. So, in your overall integration or your overall conceptualization of the case, we really don't want this to be something that it seems like a computer could have written, right? So don't just list out which scores were average, which scores were low average, which scores were below average. You want to integrate that information across tests and within the context of all of the history that right, to come up with what is their profile, what is your overall interpretation. And so I think too, one thing to think about too as fellows is these common pitfalls that we see for these samples, these are also things to really be working on with your supervisors and things to be thinking about as you're doing your cases, during fellowship is, am I really, providing an integrative summary of the overall conceptualization of the case that is not just, IQ is average, memory was below average, working memory was low average. Like, what is your overall conceptualization that's really integrating all those findings? Similarly, we're really looking for recommendations that aren't cookie cutter, right? So, if you're just cut and pasting the same recommendations for a 5-year-old that you are for a 16-year-old, that's probably not sort of demonstrating your knowledge of development, right? So are your recommendations developmentally appropriate, culturally appropriate, accessible to the family, appropriate for the, situation? So really making sure that these recommendations are evidence-based and really, really specific to that individual. Also, again, writing style. So again, this is a thing that so many, people in our training programs are really thinking about is, are we communicating our findings in a way that's appropriate for, stakeholders? Is that appropriate for families, for schools, and the medical providers? And, I think in pediatrics, we have a different audience sometimes than adult neuropsychology. And so is our writing, is our report consistent with that? So a couple things just, to wrap up, things that you should be thinking about during fellowship. So, if you're thinking, I, am specializing in pediatrics, I want to be a pediatric subspecialist, when I finish the boards in clinical neuropsychology, what should you be thinking about now? First off is, are you getting those 1,000 hours of supervised experience? So obviously it is possible to get supervised experience once you're out of a formal training program, but that is very difficult and it's a lot harder to make that happen. So you're going to want to make sure that you are getting those 1,000 hours of supervised experience while you're on fellowship. Again, if you're primarily in a pediatric fellowship that you're doing at least half-time clinical work, you'll be totally fine on that. But again, if you're in a more of a lifespan fellowship, you'll want to look at, are you getting enough pediatric specific cases that would make you a good candidate and, that you are getting that training. As I said, think about the criteria for practice samples when you're working with your supervisors on your cases. So you're going through these cases with your supervisors, in a lot of detail. And when you're writing your reports, think about, would this be a report I would want to submit for a practice sample like this? Am I touching on all these pieces? Am I, using, personalized recommendations? Am I making sure that this isn't written in jargon that the family can't understand? So and really use your supervisors during fellowship to help work on those things that are going to be some things that you'll be evaluated on once you get to this stage. Also, an idea may be talking to your supervisors about writing a mock supplemental section for a case that you've been working on together. So again, obviously that's not going to be a case that you would, ultimately submit, since that has to be one, that you're doing as an independent practitioner. But I think it's a good learning experience to think about, okay, I have this case. What would I write in a supplement? How would I defend this? And so what would I write up? And that could be a great supervised experience that you could work on during your fellowship. And then the final thing is really just plan to do the pediatric subspecialty when you're just thinking about your life, and, when you plan on going through the ABPP process in general, really when you're kind of mapping out that timeline. I think it makes going through the pediatric subspecialty a lot easier if you sort of have this in your mind as sort of this is your next steps in that process. And then finally, I just wanted to point out some resources. So this book, I'm not an author in this book, so don't have any financial stake in this, but it is a really good book that goes through the overall process. So this is different than like the board study guide, and that this is just talking through the process, but there's a great chapter written by Kira Armstrong in this, that it just goes through the pediatric subspecialty process. So a lot of the information too that we pulled together for these slides also comes from Kira's chapter in this book. So I definitely recommend this book. We do have our committee. So we are the Pediatric Subspecialty Board Promotion and Mentorship Committee. So people are free to reach out to us with questions. So we are not practice sample reviewers for the pediatric subspecialty. So we can provide direct mentorship or feedback on your cases, since we're not the ones making those decisions. You can get a SAC mentor through the AACN program. And so, requesting a mentor that has gone through the pediatric subspecialty process is something you can do, to have someone maybe outside of your program that kind of gives you some outside mentorship, and they can help, throughout multiple steps of this process. And then I'll put in a plug for BRAIN, which a lot of people may be aware of. So that's Be Ready for ABPP in neuropsychology. It's a lot of that is really focused on the parent board, but there is a section on their website for study materials for the pediatric subspecialty, and we're also working with them too to provide some more content for some of the pediatric specific things to be thinking about. And I think, just general putting it out there, even outside of these more formal resources, to me, some of the best resources is colleagues and other folks going through this or have gone through this. So really thinking about this as a process that we, there's a lot of people who have gone through it and really want to help support people also going through this process. And I think, the final thing that I'll say is, people really want you to pass and be successful in this. So, it's not set up to be, a huge, a big, it's not set up to trip you up, right? It's there to, show that you can demonstrate your competency as a pediatric neuropsychologist, but we want people to be successful going through this process. So as I said, feel free to reach out to me with more questions, and I will stop here too, so that we can, let's see, be open for some questions.
Thank you so much, Dr. McNally. What a wonderfully comprehensive and helpful talk that was. We do have a couple questions in the chat. The first question is, does the pediatric or parent board have a policy on extended sick time or medical leave during fellowship? For example, maternity leave of 8 weeks. Does the missed time at fellowship need to be made up?
So that is, really dependent more on your program, right? So in terms of, pediatric subspecialty, you really just need 1,000 hours of supervised work. And so if you missed like a portion of your fellowship, that would, you would still probably be able to make those hours up in terms of, still meeting those 1,000 hours. I think the policies on like whether or not you need to make up time for your fellowship really kind of depend a little bit more fellowship to fellowship. And so I don't think there's an overall policy on that. But, if you miss part of those 2 years, you still may be able to be, determined that you've completed your 2-year fellowship in neuropsychology. But I would say talk to your fellowship director specifically about that, because that may vary location to location.
Okay, and then a second question, what do you recommend for people who work primarily with children with neurodevelopmental disabilities such as autism? Are these cases accepted, since we may not be able to talk about direct brain behavior relationship, for example, tumor, TBI, et cetera?
Yeah, no, that's a great question. And so, again, in pediatrics, a lot of people do work in more neurodevelopment, and that's okay. I think you do have to, in some place in your sample, talk about the role of the brain in terms of the overall profile. So even if it's not something like a localized lesion, like a brain tumor or a brain injury, right, still being able to talk about the role of, the brain specifically in terms of how that may be, related to the profile that you see. And so it doesn't have to be a lesion. I do think it's a little harder to do a neurodevelopmental case just because, kind of writing that out is not as clean, right, as saying they have a lesion here and this is why they have this profile. But there's certainly people that have gone through with neurodevelopmental cases.
Great, thank you. Any other questions? All right. Well, that's pretty much perfect timing.
Oh yeah, that's good. Awesome. That worked out.
If anyone has any future questions that come up, we can help to connect you to Dr. McNally through ABSIN. And thank you again so much for doing this talk for us. We'll upload this on, like I said earlier, on the ABSIN website sometime within the next several days.
Great. Thank you guys. Thanks everyone for coming.
Bye, thank you.